So this is going to be a video about my consultation with Dr. Steve Merton in Sydney and the process I had to go through to get it and what the consult was like, etc, etc. But first I just want to acknowledge that second puberty does suck, and obviously I've got a little bit of a breakout happening on my face and also some chest knee happening, and just for those of you playing at home, the back knee action. So that sucks. But hopefully the chest and back stuff will go away when I don't have to wear a binder anymore, which will be in 55 days. Well, I'll still have to wear a medical binder for a little bit after that, but still. And the face stuff is probably just because I've been eating like shit, to be honest. Because I'm on a working holiday. It's not really a holiday at all. I'm just working interstate. That's why I'm in a hotel room. Okay, so, Dr. Merton. Before I started tea, I contacted his office and asked if you can get the surgery without taking testosterone, and they said yes. However, if you are planning on taking tea, or if you're on tea and you see him, he would rather you wait until you're 6 months on hormones before he operates. Probably because of the muscle and fat changes that are happening in your body, so you can get the best aesthetic look. So to get the consult, I brought my GP letter, referral thing, and a psychiatrist letter. The psychiatrist I saw was Dr. Michael Scott in North Sydney. He was a freaking top bloke, good dude. The consult fee for Dr. Merton's consult was $250, and you get about $70 back from Medicare for that. And yeah, I saw him for like 15-20 minutes max. Like, imagine getting $250 for 15 minutes of your time. My best friend went with me, and it was really cool, and I'm very happy, thank you, Dingus, because it was in the morning, and she's not a morning person. But I'm so glad that I took a friend with me, so bring anyone with you if you want. He asked in the consult how long I'd been on hormones for, how I'm going health-wise, mentally and physically now that I'm on them. Do I feel better on them? You know, how's my body been reacting to it? Stuff like that. Am I on any medication? Any history of illnesses, etc., etc. And then, yeah, while I was in the waiting room, you just fill out, a generic form like you do when you go to any medical consult. So I got my shirt off and sat on his table. He measured with a measuring tape, like from my collarbones down, like across my chest, and then he asked me to lift my boobs up, I guess, so he could see how low they are sitting or whatever, I don't know. And he asked me what size I would be if I were to wear a bra. And then we sat at his desk and looked at some before and after photos of him using different techniques on patients. Some of the photos are pretty graphic, but he asked me first if I was cool with seeing those before showing them. Then he talked about this new technique he was using that's similar to what he does to people for breast reductions. You keep the nipple intact, just cut around the areola, take out the excess tissue and skin that you don't need, and then pull this top bit of skin and then pop the nipple through it. So you keep it intact, keep it alive. But he said I might not be eligible for that because my chest is so large, my boobs are sitting way down here, that the fibers that connect the nipple, when they bunch up under my chest, it might look a bit lumpy and stuff like that. But he said if that's the case, then 6 to 12 months post-op, I'll go under again, and he'll do a free revision where he takes out some of that extra fiber and then does a bit of lipo and stuff like that. So that would be annoying to do that again, but it's going to be free. And he showed me the cost, and I almost died, so there better be something fucking free at the end of this. It was about $9,500 after Medicare rebates, and that is not including your hospital stay. That's just him and the anaesthesis. So I called my health cover straight away. I'm with HIF, and I don't have the top hospital. I've got like the gold starter pack or something like that. And so I asked them if I'd be covered. I gave them the item numbers and stuff like that. And I made a reaction video at Summer on my channel. They said they would cover it, which is awesome because he operates out of Macquarie Uni Hospital, which is a private hospital, so that's pretty snazzy. But yeah, so all in all, that was my consult with Merton. Top bloke, really dry sense of humour. He never cracked a smile when I was trying to make him break. He just keeps a straight face. But yeah, he's really cool. Really serious about what he does. He asked me, if I cared about my nipple sensitivity and, if I care how much I cared about the aesthetics of it and blah 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 blah. I can't remember what I said to those things. I don't really care about nipple sensitivity at all because my nipples have just always been overly sensitive or undersensitive. I don't know. I just want a flat chest. I don't really care if I have no nipples, to be honest. So, yeah. It's 55 days till surgery. So his wait time was about 4 months? 5 months? Anyway, yeah, 5 months. I'm having surgery in August, and my consult was in February or March. Yeah.